What's up, good people? Welcome back to my channel. I'm Wangui Mwangi, and today I'll be looking at a PID or pelvic inflammatory disease, and this is more of a continuation of what we had looked at in the previous video. PID is an ascending infection from the vaginal tract into the female reproductive organs, which include the cervix, the uterus, the fallopian tubes, and the ovaries. It normally happens as a result of an untreated infection, may it be fungal infection, parasitic infection, or bacterial infection. And the most common bacterial infections that can lead to PID are an untreated chlamydia infection or gonorrhea. So the risk factors of acquiring a PID are having multiple sexual partners, having a partner or being in a relationship with a partner who has multiple sexual partners. We also have dodging or using feminine hygienic products, and this actually normally brings an imbalance between the good and the bad bacteria in the vaginal area. Another risk factor is childbirth, and this would happen if the delivery was conducted in an environment that is not hygienic. We also have invasive gynecological procedures, for example, the insertion of IUCD as a birth control method. We also have manual vacuum aspiration or MVA, which is a procedure that is normally conducted in case a mother incurs an abortion. So let's look at the signs and the symptoms of PID. One of them is vaginal discharge, which is abnormal and foul smelling. We also have a low abdominal pain, which is actually bilateral. There is lower back pain. There is bleeding abnormalities, which includes intramenstrual bleeding or bleeding in between menses. We have postcoital bleeding or bleeding after sexual intercourse. We also have menorrhagia or heavy menses. We also have urinary symptoms, which include frequent micturition or frequent passage of urine. There is pain during passage of urine, which is referred to as dysuria. There is also difficult passage of urine. So for the diagnosis of PID, majorly history and entailed history taking as well as physical examination by the doctor normally gives a diagnosis. But you can also have something referred to as high vaginal swab, whereby the part of the discharge is taken to the lab and they conduct a microscopic culture and sensitivity of the discharge so that they are able to identify the specific microorganism that is causing the infection. So management of PID is majorly by use of antibiotics, which include ceftriaxone, metronidazole, doxycycline, romycin, and many others. So ensure that you go to the hospital so that you are examined, and then you're also investigated for correct diagnosis. So for prevention of this infection, ensure that you are treated in time in case you have an infection, to avoid the infection from complicating into PID. Practice safe sex, and also ensure that your partner is treated. So PID has a number of complications. So one of the complications of PID is ectopic pregnancy, and this happens when an untreated PID causes scarring of the fallopian tubes, and this will in turn interfere with the passage of the fertilized egg into the uterus. And you know that fertilization normally takes place in the fallopian tubes, but then implantation and development of the fertilized egg takes place in the uterus. So the scar will interfere with passage of the fertilized egg from the fallopian tubes into the uterus for implantation. Another complication is infertility from scarring of the fallopian tubes. We also have chronic pelvic pain. We also have recurrent pelvic inflammatory disease. And we also have Tubal ovarian abscess. Thanks a lot, guys, for watching. Remember to subscribe if you're new to my channel. And also help me share the video. Someone out there may need this information. See you in the next. Thank you and bye.